Welcome to the JFK podcast. Before we start, the hosts, including myself, Franco, Josefina, and Kim, would like to thank the sponsor for today's podcast episode, which is Life Change Recovery Center. Thank you very much, and hopefully enjoy the podcast. Hello, beautiful world. Welcome to the JFK podcast. I am Franco, and for today's episode, we have our usuals. We have Josefina,
Hello to those who are watching us.
and we have Kim.
Beautiful day to those watching us.
So, guys, what's our topic for today?
So, our topic for today is very timely, especially because most of the world is in a pandemic right now.
Ooh, what is it?
Our topic for today has something to do with mental health.
Is it about mental health stigma?
Oh, nice guess, Kim, but we can cover that in another video soon.
Is it about anxiety?
Yup, it is about anxiety. We actually have the luxury to have an expert on the topic to give us his insight regarding anxiety as a whole. But before we start, let me introduce you to our guest for today, Dr. Randy. He is a life coach, psychotherapist, clinical psychologist, psychiatrist, physician, and osteopath. So, Doc Randy, why is it important to discuss this topic, especially in our situation now?
Now, this topic of anxiety is very important because you yourself may have experienced some degree of anxiety during this pandemic period. I mean, who hasn't? People of different ages, young and old, people of both sexes, male and female, people of different socioeconomic status, rich and poor, all of us have been shaken from our daily life routines and activities and suddenly and forcibly pushed into a new situation. This new situation is what we call the new normal. But how can we even call it normal? Because in truth, it is really a new abnormal situation. And everything that is happening now, which is related to COVID-19, is just provoking in us some degree of stress, depression, or anxiety. For instance, until now, most of us are experiencing some financial hardship. Some of us are experiencing job insecurity. All of us are experiencing a sense of uncertainty for the future. You know, what's going to happen? When is this coronavirus pandemic ever going to end? Will it really end next year? Will our financial resources be able to sustain us until that time? Will we ever be brave enough to try the new vaccine when it is just newly developed? So there are so many uncertainties running through our minds. Another factor that is anxiety-provoking is really the sense of trappedness or isolation within our very own homes. Before the pandemic, we would be excited. We would look forward to going home after a full, hard day's work. But now, we have become prisoners in our very own homes, and we are raring to go back to the workplace. We're raring to go to the malls. We're raring to go back to school. But we can't. And so now we feel trapped at home. And another factor which is causing us anxiety is really the fear of getting infected by COVID-19. And it's not a fear just for ourselves, it's also a fear for our loved ones, for our friends. And accompanying that fear of getting infected is also the fear of dying from the virus. So feeling anxious during this pandemic period is just a normal reaction.
Interesting take on anxiety, Doc. I guess it is normal to feel anxious in this pandemic.
I completely agree, Franco. With the many factors affecting us now, it is understandable to be anxious.
Yeah, I guess that's true. But my question is, what does it really mean to be anxious, Doc? What's the definition of anxiety?
Anxiety is the feeling of fear, of worry, of tension, of uneasiness, and it is a normal reaction to stress. Therefore, all of us will be experiencing anxiety from time to time. Now we know that anxiety does not feel good. However, anxiety can actually be a good thing. For instance, anxiety is able to boost our energy level so that we're able to accomplish our tasks and focus on the work at hand. Anxiety can also be a good thing because it can warn us of dangerous situations. It can make us extra alert or vigilant so that we can either fight or go into flight or freeze according to what's necessary.
Oh, so it is normal to be anxious from time to time.
Yeah, I guess that's what helps me do my schoolwork so that I wouldn't get stressed near the deadline.
But when does anxiety get unhealthy, Doc?
Although anxiety is a normal reaction to stress, it can also develop into something abnormal. Abnormal anxiety happens when the anxiety becomes too intense and overwhelming, or it gets prolonged, or when it gets too frequent, or when it starts disrupting or interfering with our daily life routines, such as schoolwork, job performance, or it affects our relationships. And anxiety also becomes abnormal when there is no apparent reason to feel anxious.
Oh, interesting. How about in the Filipino context? How is anxiety portrayed in the Filipino culture? Because my grandparents don't really use the word anxious, so I don't really know. How could I tell?
Speaking of culture, Filipinos have many words that denote the experience of anxiety. For instance, they'll use words like di mapakali, balisa, pag-aalala, nababagabag, nababahala, nervyos, kaba. And just because there are many Filipino words that denote anxiety, this implies that anxiety and anxiety disorders are a common experience for Filipinos.
Oh, so that's how you can tell if someone is anxious. So are there different kinds of anxiety disorders?
One type of anxiety disorder is what we call GAD, or Generalized Anxiety Disorder. This is a condition wherein the person is worrying all throughout the day, every day, and about everything. So the person may be worrying about what is heard on the news, about what happens at work, about what happens with other people, about what happens in so many situations. And so this is non-stop worrying, which is causing anxiety 24/7. Another type of anxiety disorder is what we call panic disorder. And from the name, it is characterized by panic attacks. And the panic attacks may manifest with palpitations, shortness of breath or hyperventilation, of trembling, of cold clammy sweat. And panic attacks actually feel like heart attacks, and thus it feels that bad. A third type of anxiety disorder is what we call social anxiety. It's also known as social phobia. wherein the person is afraid to mingle with other people because of the fear that they may be ridiculed, embarrassed, criticized, judged, or rejected. Therefore, they would rather remain alone and not mingle in crowds. A third type of anxiety disorder is what we call social anxiety. It's also known as social phobia, wherein the person is afraid to mingle with other people because of the fear that they may be ridiculed, embarrassed, criticized, judged, or rejected. Therefore, they would rather remain alone and not mingle in crowds.
I see, Doc. So there are other disorders that are related to anxiety.
I just like to add that I have actually heard some of those terms before. I just didn't know they were under the general term anxiety disorder.
Really interesting. So, what are the causes and symptoms of anxiety disorders?
There are many causes of anxiety disorders, and the first one on my list is genes or heredity. If there is one parent, or worse, there are two parents that have anxiety disorders, then the children are most likely to develop anxiety disorders themselves. A second cause would be intense or prolonged stress, because the stress is constantly producing adrenaline in our bodies. So now, even when we are at resting state or relaxing, the body might make the mistake of still producing adrenaline. And if there is an adrenaline rush felt, then that is what we call the panic attack. Another cause would be suppressed emotions. So when we keep our emotions within ourselves, then the energy of the emotion remains in our bodies, and then they transfer into organs like the heart, causing palpitations. It can transfer into the lungs, thereby causing hyperventilation, or into the skin, causing cold, clammy sweat. Another cause for anxiety disorders would be some medical conditions such as hyperthyroidism or arrhythmias. It can also be caused by drugs, especially illicit drugs. As we very well know, shabu, cocaine, are uppers, and therefore may cause anxiety. And lastly, another cause that I'd like to mention would be caffeine in the form of coffee, tea, chocolate, and other caffeinated foods or drinks. Anxiety has many symptoms. For instance, there is the nervousness and restlessness, and then there could be the palpitations, the shortness of breath or the hyperventilation, the cold clammy sweat, the tremors, and then the person could feel very uneasy and restless, and it could be accompanied by a fear of losing control, of going crazy, or of dying.
I see. So, there are many factors that can contribute to anxiety disorders, as well as the many symptoms that can affect you.
But Doc, are there readily available treatments for these disorders like medicine or therapy?
When we talk about treatment for anxiety disorders, we are actually talking about a treatment package which consists of 5 elements. So the first element would be antidepressant medication, because antidepressant medication, when they are taken for more than 2 to 3 weeks, produce an anti-anxiety effect. And the good thing about antidepressants is that they are neither habit-forming nor addictive, unlike tranquilizers. A second component of the treatment package is talk therapy or psychotherapy. because it's very important for anxious patients to express, to relate the physical sufferings that they are going through. And it's very important for them to express what is disturbing their emotions and their minds. In fact, it is a very great relief for them to let it out verbally. A third component of the treatment package would be stress management techniques. So, we teach our anxious patients how to do breathing exercises for relaxation, how to do meditation for relaxation, and how to do yoga or qigong for relaxation. A fourth component of the treatment package is natural therapies. So one natural therapy that we can do on them is hypnosis for relaxation. And we can also do acupuncture to relax them. Or they may have regular massage sessions for relaxation. And the last component of the treatment package would be making healthy lifestyle changes. One important change that they can do is to avoid taking caffeinated foods and drinks. And it's also very important for them to engage in daily aerobic exercise, which lasts for at least 30 minutes.
Oh, now I get it, Doc. Treatment is not just taking medicine, but it includes other factors as well to get better.
Wow, I learned a lot of things about anxiety today. Hopefully, with the knowledge that we gained from Doc Randy, we can apply it in our daily life to have a healthy amount of anxiety, to finish our tasks and avoid too much of it.
You are right, Franco. Hopefully, the viewers can spread the word about what anxiety is.
Speaking of words, do you have any last words to our viewers, Doc Randy?
So as a final word, I'd like to tell you that there is always hope and there is always help for people suffering from intense anxiety or anxiety disorders. And the promise is that if you just get the proper treatment package, then most likely there will be significant improvement that you will feel within 2 to 3 weeks. So thank you very much. Keep safe and God bless us all.
Thank you very much, Doc Randy, for those encouraging last words. So that's it for today's podcast. Thank you for watching and have a beautiful day, beautiful person.